So, here is a simple and practical way that I prescribe Chinese herbal formulas as a doctor of acupuncture and integrative medicine. I think of it in layers. So, step one, I like to identify the primary pattern. So, I ask myself, what is the main pathology? What is the main pathology? And so my thought process, thinking in terms of traditional Chinese medicine, is it qi deficiency? Is it blood deficiency? Is it yin deficiency, yang deficiency, qi stagnation, blood stasis, dampness, phlegm, heat, cold? So I am thinking about all of these when I'm asking the patient questions and looking at them. So then I choose a formula that addresses the primary pattern. So I choose a formula that addresses the primary pattern. So, like, for example, if they have spleen qi deficiency, it's a Tong, right? Liver qi stagnation, Xiao Yao Fan, blood deficiency, Si Wu Tong. If they have kidney yin deficiency, you guessed it, Lu Wei Di Wang. So I think of those first. And then second, I identify the secondary pattern. So most patients have more than one pattern. In an ideal world, we say one pattern, but no, they have more. So I have to ask myself, what is complicating the picture? What is complicating the picture? And some examples can be qi deficiency plus dampness, liver qi stagnation plus heat, yin deficiency plus empty heat, spleen deficiency plus phlegm. So I modify the base formula or select a formula that addresses both patterns. And then step three, treat the branch symptom. So I ask myself, what is bothering the patient most right now? What is bothering the patient most right now? And some examples can include insomnia, pain, constipation, anxiety, hot flashes, coughing, chronic cough. These are some things that can be bothering. So I would add maybe 1 or 3 herbs or choose a related formula variation. Now, step 4, I will assess, is it excess or is it deficiency? Now, a quick question before prescribing um, that I would think about for myself is, am I draining? Am I moving, tonifying, or am I clearing? So if a patient is weak, with a weak constitution, I would avoid excessive purging or draining, right? Now, if the patient is robust with excess, then I would avoid excess tonification. So, step 5, when the patient comes, you come see me again, or the patient comes again, reevaluate every visit. And I would ask the patient, is the energy better? Is it sleep better? Is the digestion better? How's your bowel movements? Did they improve? And some main complaints that they have previously, are they improving? And if yes, if all these things are proving that they had before, then I will continue or gradually simplify the herbal formula. So, but if no, if it's not improving, if the formula that I prescribe, they're not improving, I will reassess the diagnosis instead of just endlessly adding herbs. So I have to go back to the drawing board and say, this is kind of like a math problem when you're dealing with patients and creating herbs for them, custom herbs, because, you know, sometimes you get it right the first time, sometimes you don't. So you have to reassess the diagnosis so you can really find herbs to help them. And so the clinical shortcut for many chronic cases, this is a clinical shortcut that I kind of think about in my head. The root, usually the root cause of some issues is a spleen, liver, or kidneys. And the pathogen is usually damp, phlegm, heat, or stasis. And then usually the symptoms could be pain, sleep, and digestion, and mood, and blood sugar problems. Um, for example, let me give you an example. Cause of type 2 diabetes, spleen qi deficiency plus kidney deficiency. The pathogen is dampness and phlegm, and the symptom is elevated glucose. Now, let's take another example. Anxiety. Okay. The root of anxiety is heart blood deficiency or kidney yin deficiency, and the pathogen is liver qi stagnation. And the symptoms are palpitations and insomnia. Now, let me give you one more example. SIBO, small intestines bacteria overgrowth. Now, the root cause of SIBO is spleen qi deficiency. The pathogen is dampness and food stagnation, and the symptoms are bloating and gas. Now, a useful rule that I use is treat the root 70% and the branch 30%. So I just want to break it down for some of you TCM practitioners out there, or for people who just want to hear the thought process of a doctor of acupuncture and integrative medicine and herbalist, what they think about when they prescribe you custom herbs. It's truly it's like a math problem, and it takes a lot of training. That's why we went to school for so long. And herbs are really complicated, but yet it can be made simple. But herbs are so powerful. So I just want to express to you guys the thought process of an acupuncturist and herbalist. So next time you go see a herbalist, it's really well thought out, and we should be definitely part of your self care. Go see a licensed acupuncture and herbalist to get some herbs prescribed for you to see if it's right for you. All right. You guys have a good one.